The following ShishMed podcast is a production of drpodcasting.com.
This is a special podcast produced on site at ShishMed Connections 2019 annual conference in Nashville, as we talked with keynote speakers and session leaders direct from the show floor. We are here with Charlotte Wilson, Director of Digital Marketing and Analytics at OSU Wexner Medical Center. She and Bill Balderas, President of Futurity, did a great session using analytics, data visualization, and propensity models to personalize healthcare marketing at ShishMed Connections 2019. Charlotte, welcome. Thank you for being here. We appreciate it. First off, can you give us a brief overview of your session?
Absolutely. So our session was all about how we can leverage the data that we have to make smarter decisions about promoting app adoption or other marketing decisions. Ours specifically was focused on a project that we did last year. We were launching a brand new app called the My Health app, and we really wanted to be smart about the way that we executed our marketing plan to drive app adoption. At the same time, though, we really wanted to be smart about all of the work that we were doing to make sure that we were creating a process that was consistent and repeatable. We didn't just want to create one set of targeted personas or do one set of models based upon who's going to adopt the app. We wanted to put together our data in a way that we could use it over and over again and really leverage our investment.
Right. So when you talk about data, did you use data to help create the app or the content on the app? Or both?
We use data to help us understand who should be using the app and who would get the most value out of the app. Who's most likely to adopt the app? When we target people and say, hey, we've got a new app, we'd like you to try it, we want to make sure that we're talking to the right people, and we want to make sure that we're promoting the features in the app that are most relevant to them based upon their age, their income, where they live, what their needs are.
So really understanding who you want to use this app or who this app would be most beneficial to is really important, and you get that through data analytics, it sounds like. Is that why data is so important and why we should all use data in these types of decisions?
Absolutely. I think at the end of the day, data is our foundation for a lot of things. There are a lot of cool, innovative ideas that I think we all have bouncing around in our heads that we talk about during brainstorming sessions. But at the end of the day, the way that we're going to get to excellent execution and making sure that we're feeding people good information and we're talking to the right people about the right things is to have a good foundation of data. And that's where we really started from.
Right. So tell me, what are predictive analytics and how should we use those?
So predictive analytics gives us the opportunity to take a look at lots of different data points about a given person and help us understand and give the appropriate combination or what unique combination is going to help us understand who's most likely to adopt an app, seek out services, respond to a given campaign. That's what predictive analytics allows us to do. It allows us to make sure, again, that we are using all of the data points that we have available to us and using the right data points, using data science, using the appropriate algorithms to understand what we should be looking at in order to understand who's going to seek out a given service or an app.
Right. So you're not necessarily guaranteeing success, but you're certainly putting it in the direction where it can be most effective or maximize its value.
Absolutely.
Right. All right. So let me ask you this. On the ShishMed podcast, we focus on how-to. How can someone get started to gather and use patient data?
So I will tell you, one of the advantages that we had going into our project is that we had some things that we had already done that helped to enable our ability to complete this project. We had an existing curated data set that we were already pulling from our CRM. So we were able to creatively take that data and use it slightly differently, because we already had it sitting there. So one of the things that I would recommend to people, if you have a CRM, think about ways that you can creatively use that data. Think about the data that you're already pulling together, that you're aggregating. Are there unique and different ways that you can combine that information together? If you're not there right now, maybe you don't have that, I would say take a small chunk. Maybe there is a given audience. I would say partner with somebody in your IT group or in your information warehouse group to understand what data sets may already be out there that you can borrow and to sort of give you a jump start. The other thing I would say is look outside of your team. There's a lot of work that we did in this project using outside resources because we didn't necessarily have those capabilities on our team at the time that we initiated the project. relying on outside resources gave us the ability to identify where we needed to perhaps maybe build some skills within our team so that we could continue to do this work in the future.
Right, really good information. So creatively use the CRM, look outside your team as well. Some really great information. Charlotte, thank you so much for your time today. This is Charlotte Wilson, Director of Digital Marketing and Analytics at OSU Wexner Medical Center. Charlotte, thanks for your time today.
Thank you so much for having me.
And if you were unable to attend SHISHMED Connections 2019, you can access the session recordings by purchasing the virtual conference. Just visit shishmed.org/virtual conference. And please join us at next year's conference, September 13th through the 16th, 2020, at the Hyatt Regency in beautiful Chicago, Illinois. And if you found this podcast helpful, please share it on your social channels. And to access our full podcast library for other topics of interest to you, visit shishmed.org/podcasts. This is the SHISHMED Podcast, Rapid Insights for healthcare strategy professionals in planning, business development, marketing, communications, and public relations. I'm Bill Klaproth. As always, thanks for listening.